Hello, and welcome to the platform launch of the Ontario Pharmacists Care Campaign. I'm Joe Ragusa, I'm your host today. I'm joined by Allan Malek, who's the interim CEO of the Ontario Pharmacists Association. Allan, welcome.
Thank you.
And Jeff Mehltretter, who's the Director of Pharmacy Economics for the Neighbourhood Pharmacy Association of Canada. Jeff, thanks for joining us today.
Great to be here.
We're excited. We've got some news to share with you. These two organizations have launched the Ontario Pharmacists Care platform during this current Ontario election. We want to tell you what's in it, why it needs to happen, and some more details from Allan and Jeff about what you can do to help with it. So gentlemen, Allan, just take a second to tell us a little bit about the Ontario Pharmacists Association, who your members are and who you represent.
Thanks, Joe. The Ontario Pharmacists Association is the professional association representing about 16,000 pharmacists, pharmacy students, and about 4,600 pharmacy technicians. And these are individuals that work in approximately 4,600 pharmacies, well as community pharmacies, but also in hospitals, family health teams, long-term care clinics, and pharmacies, and specialty clinics. These are individuals who wear the white coats. These are the individuals who are university trained with either a bachelor's or a doctorate level of training. And quite frankly, in most cases, these are the individuals that patients turn to first for self-care, and many times they are the first primary care provider they see in the health system.
All right, great. So you've got staff pharmacists, you've also got some independent owner-operated members as well. Okay, great. Jeff, tell us about the Neighbourhood Pharmacy Association of Canada, who your members are and what you advocate for.
So Neighbourhood Pharmacies, we represent the business of pharmacy. Our members are the retail pharmacy organizations that most Canadians would be familiar with, the common brand names that they see every day out on the main street. Our focus is to focus on the delivery of care environment within the pharmacy and to ensure that there's a successful business environment there so that pharmacies can operate successfully.
Okay, so you're the employers, you're largely the employees, and we all know about those dynamics in any workplace, but you've come together. The two associations have collaborated to create the platform which you've called Creating Capacity, the Ontario Pharmacy Platform. So just take a second or two to tell us what it is, and then we'll talk about what's in it.
So the way we look at this is our prescription for what ails our health system. We're hearing a lot about health in this particular election, and we believe that patients need more, deserve more. We are dealing with an aging population, a growing population, and therefore the demands on healthcare and healthcare services are also going to grow. However, there's only a finite amount of time that patients have, that physicians have, and we believe that every health professional needs to be working at their peak efficiency and to the full scope of their training and expertise, pharmacists included. We can do more. We can do a lot more to help patients get the timely care that they deserve. And in doing so, we will help to create capacity in our system so that we're not looking at lineups in doctors' offices and in emergency departments.
So I think capacity is a key point here, as well as it being good health care. Jeff, there's been a lot of talk in this election about hallway medicine, hallway health care. It's a reference to people in hospitals, emergency rooms typically, because there's not enough rooms and people are put on stretchers. Is it your thinking that the Pharmacist Care platform will help with the hallway medicine problem?
Absolutely. What we're proposing are creative solutions that keep patients out of those hallways. It enables them to get the care that they need in a convenient location, their neighborhood pharmacy, and that way they don't end up in the hospitals, they don't end up in the emergency rooms, they don't end up waiting to make an appointment to see their physician. They get the care they need when they need it.
Okay, so your organizations then, with all this talk about capacity issues and hallway medicine, you sat back, you looked at it and said, what can we do to help contribute to a solution here?
All hands on deck.
To your credit. All right, Allan, the first element in your platform speaks to common ailments. It's a term that maybe not everyone is familiar with. So tell us a little bit, what are those common ailments and what do you propose that pharmacists do about them?
It's not as scientific as it sounds. It's quite simply those common, bothersome, nuisance, self-limiting types of conditions. And we're talking about things like pink eye. We're talking about sore throats, uncomplicated ear, eye infections, even urinary tract infections. Things that pharmacists see pretty much on a daily basis, and they know what medications are needed. They know the symptoms. They've been trained to look for these. Patients are coming to them quite often, late nights, on weekends when they can't either get to their doctor. They typically will come to their pharmacy as their first point of contact in the health system. We believe it doesn't make good sense for pharmacists who know how to assess these to bounce that patient over into either a walk-in clinic, wait a week or days to get in to see their family doctor, or dare I say, even to an emergency room. That's quite frankly just not an efficient way for patients to be assessed. We believe pharmacists can step up and help fill that and avoid some of these hallway medicine situations.
Okay, so what you're saying then, the pharmacists are qualified, I assume, to deal with this. And you're saying that right now, if I show up to a pharmacy and the pharmacist looks at me and says, this is a pink eye, I know exactly what's wrong with this guy, I know exactly the medication he needs, why can't he just give it to me?
That's the frustrating part. We see our colleagues in other jurisdictions and other provinces who have this scope of practice, who have the ability to take the strain off the system. They're able to provide these types of assessments and to treat these types of conditions. Unfortunately, pharmacists, despite their training, they are obligated to refer a patient to a family doctor, to a walk-in clinic, to an emergency department for low acuity, low complexity types of conditions. And that just adds strain to the system. It adds an inconvenience for the patient. We believe we can take a lot of that pressure off of our health system.
So it's a regulatory problem?
It's a regulatory problem, and we already have prescriptive authority. We have the ability to prescribe prescription medications for smoking cessation. We're just simply asking to extend that authority to other minor, uncomplicated conditions.
And how many of these conditions are in the platform?
We're looking right now at about 10. Very uncomplicated things such as, like I said, some minor eye or ear infections, some minor skin irritations, even minor pain conditions. We're talking strains, sprains, things of that nature. Skin irritations such as acne or eczema. We believe pharmacists are perfectly positioned.
So again, using myself as the patient example, pharmacist says, I know what you need, but I can't give it to you. You've got to go see your doctor. If I can get in to see my doctor the same day, which is difficult, I'm lucky, and then I'd have to come back to the pharmacy with the prescription, chances are my doctor's office is going to say, yeah, come 4 days from now or 3 days from now. He's a good doctor. I love him, but he's just busy. I'm probably going to go to the ER and deal with it.
That's correct. And we talk about these as common ailments, as minor ailments. Quite frankly, we don't look at them as minor because the individual who's suffering from them certainly doesn't consider them to be minor. They are obviously bothersome to the point where they need help. They need that assistance, and the pharmacist is right there to help them.
Okay, so the first plank in the platform then is that pharmacists should be enabled and empowered to deal with certain self-limiting common ailments which would enable patients to skip a visit to the ER or to whatever other health provider, and your thinking is that that would help to create capacity in hospitals and doctors' offices.
Absolutely create capacity, and I should point out, Joe, that we would never be doing this without making sure that the primary care provider, the physician, the nurse practitioner, the individual who normally would look after that patient, that they are kept in the loop, that there would be communication in terms of everything that the pharmacist is going to be doing.
Okay, sounds good. So Jeff, the second plank in the platform speaks to vaccines, and the two associations are calling for the authority, I guess, from government to let pharmacists administer more vaccines, building on the success of the flu shot program.
The flu shot program has been a fantastic success, and if you're one of the 1.2 million Ontarians that had your flu shot in a pharmacy, you really appreciate the convenience and the quickness with which you can get that flu shot. All vaccine programs encourage as many people as possible to get vaccinated. That's where you get the real public health benefits to the population as a whole. And the types of vaccines that we're talking about are the shingles vaccine for those over 65 to 70, HPV vaccines, pneumococcal vaccine. These are vaccines that the government is paying for and wants people to get. Having it available in pharmacy just enhances that accessibility and makes it more likely that they're going to get the vaccine.
Okay, and the pharmacist has been trained on how to administer a vaccine because he or she is already giving the flu shot.
That's right.
To patients. Is there any additional training? Is it any different if they have to give these other vaccines that you're talking about?
Well, each vaccine comes with its own set of indications and side effects and things to watch for. So pharmacists would, as in any situation where a new drug would be added to their list of medications that they dispense, they would learn all the ins and outs of that particular vaccine.
Okay. We're talking about immunization, and the health benefits, as you indicated, are well known. We don't have to have a debate about whether or not more or fewer people should get vaccines. That's a given. And then the thinking is that if more people receive their vaccines in a pharmacy, which is convenient, accessible, safe, cost-effective, all of the good things, fewer people get sick.
That's right.
Fewer people end up in the hospital, therefore creating capacity.
Yes.
Have I got that right?
That's it in a nutshell.
Okay, and you mentioned 1.2 million people in the last flu season took the pharmacy option, which is great. So we're going to assume that some number of those would have contracted the flu and ended up in other parts of the healthcare system.
Yes, that is a fact. Those people would have ended up. There is a portion of them that would have had the flu. Flu is actually a very serious condition, and there are a number of deaths every year from the flu. But they can be avoided with the vaccine, and by making it more accessible, we help reduce that burden.
No appointment, I'm in the pharmacy because I'm buying something and I might as well get my flu shot while I'm here.
Yeah. And so not only is there benefits to the healthcare system, but also to society as a whole. In Ontario, people take less time off work if they're not sick. Even if they don't end up in the healthcare system, they take less time off work. It's much faster for them to get their flu shot. So again, they don't have to take time off work for a doctor's appointment. They can run and do this at lunch hour. They can do it after work. They can do it easily when it suits their schedules. So a lot of benefits all around.
And it seems to me that if 1.2 million people took the option last year, then there is a greater acceptance, a greater openness on behalf of the public to get more health care provided from their pharmacists. Is that a safe statement? Yes,
and growing every year. It continues to grow. We've been doing this since 2012, and every year it's growing.
Okay, and again, these are for vaccines that are already being done in Ontario, funded in other parts of the healthcare system. We're not proposing some newfangled vaccine that's never been done before.
That's right.
Nor are we proposing that pharmacists give injections for treatment of illnesses. We're talking about vaccines, immunization, the preventative stuff.
That's right.
Okay, that makes sense. All right, Jeff, I'm going to stay with you for a second. The third plank in the platform, which is kind of interesting and timely, is your organizations are calling for medicinal cannabis, so marijuana and the products of marijuana, which are taken medicinally, to be distributed in pharmacies in this province. And just for folks who may not know, the federal government, which controls the criminal code, is legalizing marijuana and has said to the provinces, each of you decide how you want to distribute this within your own borders. Now, Jeff, the Ontario government has said that recreational cannabis will be distributed through government-owned stores, similar to the LCBO stores that we have in this province. But you're not talking about that here. You're talking about medicinal cannabis.
We're talking about patients that have conditions where cannabis is helping them today. We don't want those patients to be forgotten in the move towards recreational cannabis. I myself, I have a friend with multiple sclerosis who's taking cannabis medicinally. It's the only thing that really seems to help her. And she said to me, I would really like to get this at my pharmacy with my regular list of medications, just to integrate it into my usual routine, and get the professional advice. I think the concern is that, you know, these patients that need the cannabis are going to be left on their own, and we think they should have the benefit of a healthcare provider to help them make good choices for their care.
In the absence of a pharmacist taking the time to talk to the patient about it and actually dispense it, your friend with MS, what would be her options?
Well, you know, they're sort of, in many ways, they're sort of left on their own to decide and think about what kinds of cannabis would work for them. You know, they would be accessing the product through a licensed provider, and it's a completely separate system. It's the only product in the healthcare system that is isolated in this way, and split out from all the other drugs and the regular drug system. So it's a bit of an oddity, and quite frankly, it doesn't make a lot of sense to isolate it that
and
way.
She might be ordering it online, and it arrives in the mail.
It arrives in the mail. You know, she doesn't see people face to face that often. It's all done on the phone and or online. So it's a very distant sort of interaction.
And are we expecting with the decriminalization that there will be people using it for the first time, and they may have questions on how much, how often?
That's a very good point. Yes, there will be people who will decide all on their own to use marijuana to treat whatever condition they will have. And if they're not talking to their pharmacist about that, it could very easily interfere with other things that they're taking, other drugs that they're taking, and it may leave them without, you know, access to good advice. So you know, they could be you know, trying it on their own for the first time.
Now, pharmacies don't sell cigarettes and cigars and other things that you smoke. We're not talking about the
No, we're talking
here.
about the oral forms, the ingested forms. It's typically an oil that's ingested today. But we do anticipate with the legalization process that ultimately there will be many different dosage forms. We've seen this in other jurisdictions, topical, lozenges, patches. There's a whole range of different dosage forms that are available in other parts of the world, and ultimately that'll come to Canada. And again, professional advice will help patients choose the right format that will work best for them.
Yeah, and I mean, not as someone who needs it or uses it, but I feel comfortable knowing that before the product goes out into my community, that a pair of hands that belongs to a skilled pharmacist is the last kind of goalie before stuff goes out there. And as it is with opioids, right? And your people are dealing with opioids every day. You're dealing with methadone every day. So I think the risk is greatly decreased when your folks are involved.
Pharmacists have systems for managing those sorts of products already, and they're very well set up to be able to handle that.
Did you want to add something on the cannabis?
Just on the cannabis, yes. When we were looking at the fact that we are in the midst of an opioid crisis, that doesn't seem to be showing any signs of letting up. We're very cognizant of the fact that there's a growing body of evidence to show that medicinal cannabis can be a huge benefit to those individuals who are trying to get off of opioids. There are many people who are now becoming very nervous about opioid therapy for treatment of chronic pain, and they're looking for alternatives, whether it's non-opioid, traditional pharmaceutical products, or medicinal cannabis. And we believe that pharmacists are ideally poised in the community to answer those questions, provide advice. As Jeff said, there are, and at last count I've heard that there are over 600 drug interactions, some minor, some a little bit more significant, but a very large number of interactions with cannabis, and the pharmacist is perfectly positioned in the community to help provide that guidance not only to the patients but also to prescribers.
Well, guidance, and if your folks have it in the pharmacy, could you say to patient, maybe instead of that opioid, maybe you can sort of try this, but if you don't have it in the pharmacy because you're not allowed,
That's correct.
all it is words then.
Absolutely. So if the patient is able to, the pharmacist can help the patient as they take on cannabis, reduce in an appropriate way, reduce the opioid or the level of opioid.
Because we're
that
talking
they're
about
taking.
pain management, right?
We're talking about
That's
pain
right.
management.
Why else would you take opioids or cannabis? It's essentially pain management medication.
Right.
Right, and I think the last point, and Jeff touched on it, in that it's the one product that's separate from every other prescription product in terms of how it's managed in the process. And when we're looking at the importance of a full comprehensive medication profile, this does not make its way onto a patient's medication profile if it's being distributed through a licensed producer. It needs to be brought into the pharmacy.
So nobody would know, I guess. But there is a physician involved that says to the patient, here's the paperwork for you to order the cannabis.
Yes,
but then that's it then. That's the last healthcare provider.
It wouldn't get captured in, and as we move towards electronic health records, that information would not necessarily be picked up in a drug review.
I think it would be good for health providers to know that if the patient's taking cannabis. All right, let's get off of that, and Allan, we'll talk about the fourth and final plank in the Creating Capacity platform. It's what you've described as point-of-care testing. So I know that for people in your field and in pharmacies, they know what that is. Maybe just take a second to share with people who might not know what it is that you're talking about and why it represents good policy.
Joe, probably the best way to start answering that question is to say what it isn't. Point-of-care testing is not the same as what we know as traditional laboratory testing, where you go to a lab and you roll your sleeve up and you get vials of blood extracted and sent off for testing for a variety of conditions, whether it's monitoring for bleeding disorders or for diabetes or for cholesterol management or for a host of other conditions. What we're talking about with point-of-care testing, and the underscore is on point of care. It's right at the site in the pharmacy where these tests, and we're looking at new technologies that have recently come onto the market over the past several years, where we're looking at real-time testing, and we're talking about taking a drop of blood from your fingertip, or taking a throat swab or a saliva swab, and testing right at in the pharmacy, right at the point of care, and providing real-time results to the patient and even to another healthcare professional.
Are you talking for all conditions?
Not for all conditions. And I should say there's a growing list, but we're talking about very typical monitoring conditions that need to be monitored on a regular basis, such as diabetes, such as cardiovascular conditions. Measuring acidity levels in the stomach, looking at, again, we talked about the throat swabs, checking for a rapid strep test to determine if someone has strep throat. These are the types of tests that can be administered in a pharmacy. They're minimally, if not non-invasive, and we're not talking, as I said, we're not talking about pharmacies becoming specimen collection centers.
All right.
We're talking about
And it's important that the pharmacist be able to do this for what? To be able to adjust my medication, to tell me if it's working. It's always with a view towards medication, right?
Absolutely, and it's more importantly, it's more about helping the patient manage their conditions. We don't like to say we manage medications themselves. It's about managing a condition and making sure that the patient is responding appropriately to therapy, making sure that a medication is. When we're talking measuring concentrations in a blood, that's where labs are the traditional labs are very important to measure those types of levels. What we're talking about is looking for markers for diabetes, for example, to determine if diabetes is under good control or if it needs to be more carefully monitored. It is about monitoring. Pharmacists are empowered to monitor therapy. The unfortunate part is we are not given the tools to do so.
All right, and right now I know that I cannot walk into a specimen collection center of Dynacare or one of the lab companies and just ask for a test. I've got to show up with a physician's requisition form.
Correct.
So now I'm going doctor's office, specimen collection center, back to doctor's office to hear my results. You're saying that for certain conditions, primarily for monitoring, go to the pharmacy, the pharmacist will check you out right away, and you'll know immediately what your results are.
That's correct. And I should also point out that pharmacists do have the ability and the authority to adjust therapy, not to change therapy from one drug to another drug, but we do have the authority to adjust therapy up or down. We can take a look at levels and make sure that, if the medication or if the patient seems to be maybe suffering some side effects, those medications can be adjusted downward.
Okay, so Joe, I'm looking at based on these test results, you don't need the 20 milligram pill. We're going to take you down to 10. Same medication, though.
Exactly. And some of these point of care tests allow that to happen without having to collect a formal vial sample of blood.
All right, so those are the 4 platforms, and we're talking about common ailments, we're talking about more vaccines, we're talking about distributing medicinal cannabis, and we're talking about point of care testing for certain disease states and monitoring. Jeff, I'm going to ask you, because you are the Director of Pharmacy Economics, can Ontario afford these things? I mean, healthcare is it's a $60 billion entity now in this province.
Right.
Are these big ticket items? Is this expensive? What are we talking about here?
We've deliberately looked for solutions that are either no cost to the government or low cost to the government. So in the case of cannabis and the point of care testing, there's really no cost at all to the government for this. That doesn't impact the healthcare budget at all. And yet it delivers tremendous value in terms of prompt access to care for patients, and delivers a great value on the clinical side, but at really no additional cost to the government. The other 2 planks, the vaccines and the common ailments, those are relatively low cost. In terms of common ailments, some of the provinces that already do this and have been doing this for years, their evaluation of the cost is that it's sort of net zero cost to the government.
Because there's offsets elsewhere.
The benefits that you get and reduced emergency room visits, reduced walk-in clinics, reduced access to the healthcare system in other places is offset by the cost of doing it in the pharmacy. So it really doesn't end up costing the system anymore.
Sure. So I understand that the pharmacies, to administer a flu shot, I mean, that the government pays for the vaccine, the medication itself, but pharmacies receive a few bucks, and that's quickly, I mean, even if a couple of patients don't get the flu and end up in ER or worse, as a result, then it's money well spent, and of course you're going to realize tremendous savings across the system. All right, so there's an election in Ontario on June the 7th. Mm-hmm. I'm going to assume that shortly after that new government is sworn in that you're going to be continuing to advocate for this. But during the election, Allan, for those people that are watching and that think these are good ideas and want to support you, is there anything that people can do to support this? Is there any actions that supporters could take in order to help you carry this message?
There sure can. I mean, I spoke to the number of pharmacists and pharmacy professionals that we represent, and the number of businesses that both organizations are representing. We need as loud a voice as we can possibly get, and we need the help of pharmacists, we need the help of the public to help send our message to the new government. So right now during the election, we are asking our members and the public to visit our website, which is the Ontario Pharmacists Care.ca website. On that site, you can actually get and download our full pharmacy platform, get a little bit more information on some of those four pillars. But most importantly, there's an opportunity to send letters not only to the MPP incumbents right now running for election, but also the candidates that are running against them, and to make your thoughts and your concerns known to those individuals. It's very important that these individuals, these candidates, are hearing that pharmacists can do more. All
right, so folks, there you have it. Ontario Pharmacists Care.ca. You can download the platform. I must congratulate you. It's well done. It's understandable even to a layman like me. And as Allan mentioned, I don't know that you send letters, they're electronic communications. You don't have to go get a stamp and an envelope.
It's real simple.
I think you put in your name, your postal code, it figures out which riding you live in and which candidates and which MPPs should hear from you. And I think it is important that while the associations do a very good job of advocating on behalf of their members and on behalf of patients, that decision makers need to hear from real people. They need to know that people with families who live in those ridings care about this stuff as well. So I'd encourage you to go on Ontario Pharmacists Care.ca. Everything you need is there. Allan and Jeff, I want to thank you for coming in. I know it's a busy, busy time for you now, and taking a few minutes to share with people what this is all about, why it's good healthcare, why it's good policy, and good for patients. So thanks for this. Folks, take a look at it. I think you'll like what you see. Thank you very much for giving us some of your time to hear what we had to say, and we'll talk to you soon.